Mahima Kalla, who is a research fellow in the Faculty of Medicine and Health at the University of Melbourne and a member of the Brains Tumour Online program, which is the other MRFF-funded adult survivorship, brain tumour survivorship grant that's functioning at the moment. So Mahima is going to speak to us about the evaluation of complex digital self-management solutions. So hand over to you, Mahima.
Thank you, everyone. So I'm going to talk a little bit about evaluation of complex digital self-management solutions. Okay, so just a little bit about me, because I haven't had the opportunity to meet with any of the other panelists and audience members so far. So a quick introduction, I'm a research fellow at the Centre for Digital Transformation of Health at the University of Melbourne. I specialize mostly in lived experience research using qualitative methods, and I like to use a number of traditional and non-traditional methods, including creative approaches to representing lived experience. I'm also an instructor for our digital health learning health system short course and a mentor for our fellowship program. So as Ariana was saying, the platform that I'll be talking about today is the Brain Tumors Online platform, which has been funded by an MRFF grant. Before I get into evaluation, I wanted to give a quick summary of the platform itself so we can better understand the challenges we faced in terms of planning for evaluating the tool. So the platform we've built has three main pillars: Learn, Connect, and Toolbox. The Learn pillar is a repository of evidence-based information, which has been curated in response to consumers' unmet psychosocial needs. So this can be everything ranging from how do I manage seizures, how do I talk to my children about my illness, all the way to can I still drive and so on. Then the second pillar is called Connect, which is like a bit of a, if you think about it, Facebook for brain tumors, where people can come together, ask questions, lean on each other for peer support, but also interface with healthcare professionals as well. So we'll have representation from a raft of allied health and medical professionals as well, connecting with consumers. And then the third pillar is called Toolbox, which is a repository of evidence-based validated self-management solutions. And in the first instance, we are trialing a sleep intervention for patients and another psychosocial education intervention for carers. So with that, I want to get into the crux of today's presentation. So the reason I wanted to present this is because there are a number of challenges around evaluating digital solutions. And just to give a few examples. So number one, with brain tumors, fortunately, given the low number of diagnoses compared to other cancers, which is obviously fortunate, but this does mean that the available sample sizes are smaller, and it makes randomization difficult, and then that has implications for statistical power in clinical trials. The second thing is that because of poor illness prognosis and outcomes, and often rapid changes in the illness trajectory, it means that longitudinal randomized control trials can be difficult as well, given dropouts and attrition and so on. The third thing is more around digital solutions as well, where, as you can see, the platform does have multiple components. It will be used by consumers on demand based on their personal need and preference. So there's no specific prescription for the use of the platform. It's not a fixed intervention like a pharmaceutical intervention with a specific dosage. So in light of that, it's hard to attribute causation and outcomes. So with that sort of thinking, we established that potentially a randomized control trial is not the way to go, but what is the way to go? So we played with a few different ideas, and we eventually landed on a single arm study. But then we were also sort of contemplating what sort of things would we measure? Can we even meaningfully affect quality of life changes in this participant cohort and so on? Is it more about distress? Is it more about unmet needs? So we really took a bit of a co-design lens to even planning for the evaluation. And in light of that, we took a multi-step approach to plan for evaluation. So this flow chart describes the key steps that we undertook. So the first thing we did some real thinking around what is the theory of change? So what desired changes are expected to happen as a result of this platform? We then looked at what does the evidence actually say about implementation barriers and facilitators for other cancer-related self-management solutions. So for this particular activity, we decided to broaden it to all cancers rather than just brain cancer, given the paucity of literature on just brain cancer specifically. We then looked at almost synthesizing the findings of the literature review and the theory of change into developing some success criteria. So we thought about, well, what does success look like for the platform? And then based on that, we were then able to sort of think about, well, which of these success criteria do we actually want to measure? And then those criteria will then help inform the next iteration of platform improvements after the evaluation. And having done all those prior planning steps, we then went on to finalize the evaluation plan. And that included things like what core and exploratory criteria do we want to evaluate, using what measurements and how often, and so on. So I just want to give a quick overview. Obviously, I can't go through every single of those steps today in the 5 minutes that I have, but I just wanted to give a quick flavor, if you like, for the theory of change component. So in order to develop the theory of change, we looked at sort of what is the most basic logic model at its core that's driving improvements for patients' unmet needs. So we looked at it from the perspective of usability, usage, and benefit. So simply put, if patients can't use the platform, so for example, they can't, when they click on a certain link, it doesn't work, or it's just at the most baseline level, it's not usable. And if it's not usable, then they're not going to use the platform. And if they don't use the platform, then they won't benefit from it. So at a very basic level, those were the 3 categories of outcomes that we thought we wanted to measure. Using that baseline foundational logic model, we came up with a more detailed theory of change. Obviously, I don't expect you to absorb all this information, but the reason I've got it up there is to demonstrate the complexity of thinking that went behind this process. So as you can see, we looked at things like purpose on the left, we looked at mechanisms of change in the gray boxes in the middle, and then you can see that on the right, we looked at what are the different outcomes that we hope to achieve. And then once we had done this thinking, that's when we were able to then take that step of, okay, these are the prompts that we want to use. What sort of other data tools or data sets we can use to inform the evaluation? So do we want some qualitative data? Do we want specific feedback on specific parts of the platform? For example, we'll be running online events in the Connect pillar. So we wanted to then understand, do we want event-specific questionnaires and so on? So once all that work had been done, in a nutshell, this is the evaluation plan. Once again, it's more to demonstrate the various facets and the mixed methods approach to evaluation. So very briefly, to give you a quick overview, it's a single-arm study. Participants fall under one of 3 cohorts: patients, carers, and healthcare professionals. We'll collect data for a number of different reasons. Obviously, there's the green boxes, which are more before-after analysis in a traditional trial. Then there's also some data that we'll collect to improve website usability on an ongoing basis. So we'll be doing some monthly reviews to make sure that the platform is working. And then there's other data analysis related questions that we'll ask for informing the data analysis, which I'll talk about in a second. So as you can see on the left, once again, I don't expect you to absorb all this information straight away, but it's trying to demonstrate the various ways in which we'll collect data. So we've obviously got your usual prompt questionnaires. We also have content analysis of the actual user-generated content on the online community. We have things like qualitative semi-structured interviews, but also looking at back-end usage analytic data as well. So just to quickly wrap up in 1 minute, talking about data analysis, given this is a single-arm study, we decided that we would do within group analysis to investigate relationships between different parameters. So like, for example, are people that are using the platform a lot more benefiting from it a lot more or reporting more outcomes? Is demographic status associated with usage? Is demographic status associated with reported benefits and so on? But the problem is that we can't predict what those parameters would be, and that will emerge when the actual data set is available. And certainly there's some health economics assessment as well, which is outside the scope of today's presentation. So just a quick slide to show all the different parties that were involved. Thank you. Please reach out if you have any questions or would like to learn more or brainstorm. Thank you.